Hey everybody, Dr. Daniel Klauer here from the AACP. So wanted to share with you some updates for this year's annual symposium. It's going to be awesome. We have some phenomenal speakers and excited to walk through those speakers with you, share it with you, and give you a little bit of background of the vision we have with this meeting to kind of elevate it to new heights and have some phenomenal speakers, expertise, and knowledge coming out of that. So I'll jump right into it. So it's October 24th, 25th, 26th, and 27th if you'd like. So 25th, 26th is the main agenda. On the 24th in the afternoon, we have mentors and modalities. So we're going to have small clinical roundtable limited to 40 people, and you'll get to meet with mentors in the industry to talk about their journey, their ideas, their theories, protocols, and things like that. So you get some one-on-one time with some experts, which is fantastic. And then the main meeting is Friday and Saturday. And on Sunday, Dr. Rick Miron, the PRF guru, is doing a facial aesthetics workshop specifically for AACP doctors based on feedback from last year's meeting and the request to get some hands-on facial aesthetics. And that's going to be done actually at my office. So it'll be in a clinical setting, which will be really, really cool. And Dr. Miron has been gracious enough to come out and do that meeting for us, which will be fantastic. So some of the speakers, and I'll go through them, kind of rapid fire. Dr. Fatah is going to be talking about the medical legal implications of treating TMJ in sleep. Dr. Koloko is a pain physician talking about placebo effect and managing chronic pain and using virtual reality to help with chronic pain. Dr. Kiefer is a psychiatrist from Hawaii. He's going to be talking about brain mapping and what's happening to these adults and kids' brains in pain and things that we can do and how nasal breathing improves brain mapping. And they'll have some documentation on that, which would be cool. Scott Manning, many of you know, will be talking about practice management strategies, increasing case acceptance, talking to patients about getting the treatment they deserve and need, and giving our team some strategy. Help a breakout session specifically for your team members. So that'll be fantastic. Get your teams to kind of level up their communication skills. Dr. Maxwell, pediatric cardiologist, he's going to be talking about dysautonomia, Ehlers-Danlos syndrome, spiky leaky syndrome, as he talks about CSF fluid leaking into our nasal passages and the implications of that and how that relates to sleep disordered breathing, chronic cervical instability. Awesome, awesome stuff. Dr. Eric Phelps, orthodontist from San Jose, he's going to be talking about how now his workup includes psychology, sleep medicine, TMJ and sleep, and orthodontics, and how he's brought that into his very, very busy orthodontic practice. He'll also be going over his airway report, as he calls it. So the workup he does for patients, what he's looking at, the measurements he's taking with pharyngometer, rhinometer, home sleep testing, awesome, awesome data. And what's great about his lectures is he's mining data. He's been mining data over the past year for this. He's actually going back right now and he's measuring things from all of the 4x extraction cases that he's seen. And he's looking at condyle position and making some inferences on that retrospective data. He's been to all the AAO meetings, all the AADSM meetings. So he's basically taking all this knowledge in airway and ortho and really kind of distilling it down. And he's going to share that with us. Dr. Anil Rama is a neurologist sleep physician. He's going to be talking about home sleep testing, brain mapping as well, and really what we as dentists should be doing, can be doing, and he encourages us to do in the sleep medicine world with our colleagues. And then Dr. Ryan Vaughn, he'll be talking about all things nose, some minimally invasive nasal techniques and things he's doing at his office and a lot of outpatient procedures in the ENT world, and then just being available to answer questions as well. So in the pre-course workshop, we have Dr. Cole, as you guys know, kind of a legend in the world of patient communication and just being yourself and doing a case presentation. Dr. Stephen, almost a stranger to no one in this industry, he'll be talking about his journey over the past 40 years in craniofacial pain and in dentistry, and sharing some knowledge on diagnostics with like JVA and cone beam, lasers, and things like that. So just half hour with him will blow your mind. And then Dr. Phelps one-on-one, and Dr. Anil Rama one-on-one, and Dr. Ryan Vaughn as well. And might even throw another one in there based on how many people sign up. So in the post-conference speaker, Dr. Rick Miron, as many of you know. So online, we have the agenda. It's all mapped out with who's going to be at each day and have a lot of great information. We're going to attract the people that are really coming for the knowledge, and we're there to learn. And we'll see some cool stuff. We'll have fun. We got dinners planned every night, things like that. So it'll be phenomenal. And my goal is to make sure that people have immense value for making the trip and the effort and energy to be away from their family and really just have a great weekend of learning stuff that they can take back and implement into their practice and enhance their skills. So I'm confident we have an agenda for many people. In the afternoons, we're going to have staff breakout sessions. So we'll have kind of our main podium lectures, and then we'll have a clinical assistance track in the afternoon both days. So we'll break those out, and we've got some great topics. To be honest, those who sign up, I'm going to query about what specific subjects you want your team to learn on, whether it's clinical exam, patient communication, marketing, strategy, things like that. So as we get those clinical signups, we're going to tailor the presentation. We already have the speakers lined up. Tailor the presentations to really hit what you want in bringing your team. If you're going to invest in bringing your team out here, we're going to invest the time and energy to make it relevant information. So that's my quick rundown. If you have any questions, feel free to reach out to me, and look forward to seeing you guys in South Bend in October. Thank you.